My client's in a Medicare Advantage plan, and he received a bill for $8,000 the other day and was very concerned. Does he owe $8,000? He does not owe the $8,000. What we figured out is that the claim had yet to have been processed. But what should have happened in this case? When there is an $8,000 bill and you are in a Medicare Advantage plan, can you get stuck with that kind of a bill? Let's talk about how Medicare Advantage plans work. So remember, typically, most of them, they have a $0 monthly premium, a zero deductible, and this is just an example of a plan in Illinois. It's a PPO. And then they have something called a MOOP, a max out of pocket that you can spend. In this particular plan, if you're in network, the max out of pocket is $3,700. If you're out of network, combined with in network, because you have out of network options in a PPO, it would be $5,750. But what does this MOOP mean exactly? Basically, with a MOOP, it's an agreement you've entered into with this Medicare Advantage plan that you're going to pay certain copays, you're going to cost share as you go with the Advantage plan, and their job is to pay most of the balance of a cost, but there is a certain amount up to a max out of pocket that you can spend, and it's going to comprise of lots of different copays. Now, most people don't even come close to that max out of pocket in a year, but if you are sick and you needed chemo, you'd be responsible for 20% of a chemo bill. Or if you had a hospital stay and it's $325 a night for a copay and you're there for 3 nights, you're spending almost $1,000. But in this particular scenario with this client, he had outpatient surgery, and the way his plan was written, it's a $300 copay. So that is what he owes. He doesn't owe the $8,000, he owes $300. And then what happens is, from that MOOP that's defined by the plan, now let's say I'm going to do the math easy, let's say it was $3,000, now you subtract out $300, there's still another $2,700 remaining for the rest of the year where you could cost share in the different copays and coinsurance defined by the plan. And by the way, with these Advantage plans, the copays or coinsurance you pay for your prescriptions do not count towards this MOOP. That's a whole nother set of numbers.